Thank you very much. Thank you for giving me an opportunity to present my topic. My topic is Chi Gong, a physical intervention. Complementary therapies are systems of healthcare that treat the whole person, not just the symptoms of their disease. Modern medicine is increasingly aware of complementary therapy techniques. Some common complementary therapies include physical therapies such as yoga, massage, and acupuncture, relaxation techniques such as meditation and visualization. Qigong is an ancient Chinese exercise and healing technique that involves meditation, controlled breathing, and movement exercises. It is believed to be at least 4,000 years old. Qigong is claimed to influence the flow of energy. Qi is the Chinese term for life energy or life sport. It is an essential part of acupuncture, Qigong, Reiki, and the martial arts of the East. Qi is the vital energy or life force that flows through the body meridian. It was not until 1953 when Liu Guicheng published a paper entitled Practice on Qigong Therapy that the term Qigong was adopted widely as a formal name for this type of exercise. It is practiced for many years in the East. There are two types of Qigong, internal Qigong and external Qigong. Internal Qigong refers to a physical... Madam, the slides are changing.
Full control, you can change the slides. You have the full control, you can change the slides. You can now change the slides, you have the control in your hand.
No, ma'am, it is not changing.
No, you can change from your side. You can click the arrow in the left side bottom of this screen, Adobe, and you can change to the next slide. Can you able to change?
No, ma'am, there is no arrow at the bottom.
In the bottom of the Adobe Connect, you can able to see one previous page, next page buttons. Left side bottom of the screen.
No, ma'am, there is no.
Can you able to scroll? No, can you able to scroll? Can you able to scroll?
No, ma'am, it is not being scrolled.
Please wait 1 minute. Now I am changing. Can you can just give me the slide number? I'll change the slides. Which slide you are in?
No, I was on introduction the term Qigong.
Slide number 4. Is it correct?
No, ma'am. No, ma'am. Previous.
Is this correct? This one?
Yes, ma'am.
Yeah, okay. Yeah,
Qigong
please instruct me.
Popular.
I will change the slide from here.
Okay, thank you, ma'am. Qigong has become a popular form of complementary and alternative medicine for a wide range of conditions, symptoms, and situations, including stress management, hypertension, chronic pain, depression, insomnia, cardiac rehabilitation, immune function, and for enhancing the quality of life of cancer patients. Next one. Ma'am, next slide, please. It is practiced for many years in the East to improve health, prevent disease, and prolong life. There are two distinct forms of Qigong: internal Qigong and external Qigong. Internal Qigong refers to a physical and mental training method for the cultivation of oneself to achieve optimal health in both mind and the body. It involves deep breathing, concentration, and relaxation um, used by individuals for themselves. Next is external Qigong. It refers to a treatment where Qigong practitioners direct or emit their Qi energy to the patients with the intention to clear Qi blockages or balance the flow of Qi within the patient. It is done by the Qi masters who claim to be able to cure some conditions and diseases. Gap analysis. So far, it has not been explained scientifically, and from a scientific point of view, it must seem biologically implausible. Hence, there is a need to have the systematic review of submitted Qigong trials for clinical applications. Aim of this study. The aim of this overview is to critically evaluate all systemic reviews of Qigong as a treatment of any condition or symptoms. Methodology. Electronic literature searches were carried out by using Medline, Embase, Sinhar, Cochrane Library, and PubMed. Keywords of the research were Qigong, complementary therapies, external Qigong, internal Qigong, and nursing implications. The systematic reviews had been published from 2004 to 2016. Potentially relevant articles identified 70, included systematic review 28, articles excluded 51, not relevant to Qigong 34, not systematic review 16, and not focus on Qigong only was 1. Results. Resistance training and other weight-bearing exercises are known to increase bone formation. Most Qigong practices involve no resistance and only minimal weight bearing. Qigong has positive effects on both bone health. Bone mineral density increased for women following Qigong exercise as compared to no exercise control. Many studies reported favorable cardiovascular and pulmonary outcomes of the participants. In this grouping of studies were generally older adults, mean age 61.2. Measures for cardiopulmonary function were representative of cardiopulmonary fitness and cardiovascular disease risk, and included blood pressure, heart rate, ejection fraction rates, blood lipids, 6-minute walk distance, ventilatory function, and body mass index. One of the most consistent findings was significant reduction in blood pressure reported in multiple studies. Cardiac health have been evaluated, such as reduced heart rate is reported. Cancer. Women treated for breast cancer achieved significantly increased distances in the 6-minute walk test in response to Qigong. Parkinson's disease. In the small crossover study of patients with Parkinson's disease, participants practiced Qigong for 7 weeks reported significantly improved 6-minute walk test. Obesity. Qigong has demonstrated a greater reduction in BMI as compared to an exercise control group in 2 studies. Physical function. Decreased physical activity is related to declining physical function in all populations, and that decline is compounded by the natural process of aging. Qigong is helpful in chronic pain, osteoarthritis, neck pain, or fibromyalgia, where majority population was older adults. that is, studies in which mean age was 55 years or older. Falling. Outcomes related to falls, such as balance, fall rates, and improved strength and flexibility, were reported in extensive literature after practicing Chi Gong. Quality of life. Quality of life is a broad-ranging concept derived in a complex process from measure of a person's perceived physical health, psychological state, personal beliefs, social relationship, and relationship to relevant features of one's environment. Studies showed that a wide range of participants, including healthy adults, patients with cancer, post-stroke, arthritis, at least one of the component of quality of life was reported to be significantly improved by Chi Gong compared to inactive or active control groups. Interestingly, one 6-week study conducted with patients with traumatic brain injury, which shows improvement in coping and muscular dystrophy. Self-efficacy is the confidence a person feels in performing one or several behaviors, and the perceived ability to overcome the barriers associated with the performance of those behaviors. Significant improvement in self-efficacy were reported. Self-efficacy for falls was significantly increased as a result of participation in Chi Gong. Autoimmune. 1 month Chi Gong practice reported improvements in a number of immune-related blood markers, including total number of leukocytes, number of eosinophils, and number and percentage of mucocytes as compared to usual care. Discussion. All of the systematic reviews have been published recently, which indicates that the scientific interest in Qi Gong is growing. This overview shows that a number of systematic reviews and experimental study designs have been conducted on Qi Gong. In studies, Qi Gong tended to be positive or equivocal. The major effects of Qi Gong was on cardiopulmonary and hypertension. However, hypertension is readily and reliably treatable with the medications also. There were minimal evidence of obesity and effects on immune system. The phenomena could also be important for the publication of systematic reviews. Limitations. Majority of the studies were based on poor quality primary data. This cannot be absolutely certain to have located all relevant articles from the databases. Publication bias can lead to an underrepresentation of negative results. Many primary studies have small sample size and lack of proper control group. Strengths. Qi Gong is the emerging alternative therapy, and this article has given us the new insight into the phenomena and its implications. Many of the important details from primary studies have been picked up and reported effectively in the article. The literature search included English, Chinese, and Korean databases and were comprehensive. Conclusion. A compelling body of research suggests the growing body of Qi Gong studies. The evidence suggests a wide range of health benefits. Most of these studies were conclusive and all were based on poor quality clinical trials. Given these important caveats, it would be unwise to draw firm conclusions about the effectiveness of Qi Gong. Recommendations: until there were high-quality clinical trials of Qigong, it would be unwise to draw firm conclusions about its effectiveness. More rigorous clinical trials are required in future to determine Qigong effectiveness and its inclusion in the list of safe complementary therapy. Now I summarize. Complementary therapies are systems of healthcare that treat the whole person, not just the symptoms of their disease. Modern medicine is increasingly aware of complementary therapy techniques. Some common complementary therapies include physical therapies such as yoga, massage, and acupuncture, relaxation techniques such as meditation and visualization. Qigong is an ancient Chinese exercise and healing technique that involves meditation, controlled breathing, and movement exercises. It is believed to be at least 4,000 years old. Qigong is claimed to influence the flow of energy. Qi is the Chinese term for life energy or life spirit, or a vital force that flows through all living things. It's an essential part of acupuncture, Qigong, Reiki, and the martial arts of the East. Qi is the vital energy of life force that flows through the body's meridians. Now, what are the meridians? Meridians are energy network of the body. They are energy channels transporting life energy throughout the body. If there are blockages, they lead to lack of energy supply to certain areas of the body. The body meridians can be used for treatment of a condition and diagnosis. There are 12 major meridians in the body. Lung
Salma, your time
meridians,
is up.
large.
Can you please conclude?
Yes, ma'am.
Yes.
Conclusion is that a compelling body of research, growing body of the evidence that a wide range of health benefits. Most of these studies were conclusive and all were based on poor quality clinical trials. Given these important caveats, it would be unwise to draw a firm conclusion about the effectiveness of Qigong. More rigorous clinical trials are required in future to determine Qigong effectiveness and its inclusion in the list of safe complementary therapies. Thank you.